Welcome back. And no, that was not Ziad snoring or Mohammed snoring there in the control room, but yes, getting a bit frustrating. And when somebody snores like this and you look at them, it sounds they're in such a peaceful state, in a peaceful slumber, but it becomes annoying, irritating, and frustrating to somebody that is laying next to them or in the same vicinity. Yes, they are in beautiful La La Land, but it affects the quality of sleep. So it's a nuisance to your bed partner. But if you're a long time snorer, you don't only disrupt the sleep patterns of those close to you, but you may in fact be hurting your own sleep quality. And to help us understanding first all about snoring, we have a sleep and fatigue consultant, Mr. JD Uys, to explain to us what is snoring, what are the causes of snoring, and how is snoring linked to our health, probably, and how can we minimize the impact of snoring. And we're going to be discussing a bit about sleep apnea as well. So, good afternoon, Mr. Ace, and I'm sure that sound we heard, people come to you either, I don't know if partners and spouses come to you as much as the person that is snoring, and maybe are there arguments of denial until recordings are pulled over. I don't know if it gets to that level as well, but I see a chuckle. Thank you for joining us here on Salam Media.
Hello, Miriam. Yes, it's a pleasure to be here to you and your listeners.
So tell us, let's go to the definition. Can you define what snoring is for us?
Snoring is number one. It's extremely common, especially the comorbidities of snoring, like sleep apnea and upper airway resistance syndrome, or what we call in broad sleep breathing disorders. It is the second largest sleep illness in the world. And what it basically means is it is a reduction or a resistance in breathing when we sleep. So it doesn't normally occur, obviously, when we are awake, but it usually occurs when we are asleep. What happens basically is as we enter in our important sleep phases, and the most important ones are the stage 4 or deep sleep or REM sleep. When we enter those stages, we tend to lose muscle tone. Okay, muscle tone is normal. We are supposed to lose muscle tone when we sleep. When we lose that muscle tone in a lot of individuals, there's a resistance in breathing where one snores. It's usually in the upper part, which we call the nasopharynx, or even down into the oropharynx, in the back of our throats, where those muscles relax, and there's no muscle tone or very little muscle tone, and that tissue vibrates, which causes the snoring sound.
So, you have in your definition, you've explained some of the causes of snoring. So, I'm told as well that a simple thing like using an incorrect pillow can cause snoring, or maybe your sleep position, such as sleeping on your back, could make you snore.
Yes, obviously, if you lie on your back, it increases the chance of snoring. Just remember that a little snoring, we all snore a bit during the night. It is not uncommon. Okay, it is when the snoring disturbs our sleeping quality, then it becomes a problem. And in terms of the pillow may have a small problem, but if one snores like your example in the beginning, like the clip you played, a pillow will not solve that problem. That's I could definitely hear there was cessation, labored breathing, which we called labored breathing, and that person definitely has a sleep breathing disorder, and he needs to consult with his doctor. So that specific clip that you played. So Other causes of snoring are obviously people who smoke, that may increase snoring. People who are overweight, that may also, enhance snoring. And then snoring can occur in any position, but it's most prominent when you lay on your back with your chin close to your chest. Um, that's when it mostly occurs. But if the snoring is serious, Maria, then normal, a pillow won't solve the problem. It definitely won't. Or even lying on your sides definitely won't
So,
solve a problem if it's
mm,
serious.
and if it's serious, what are some of the what is a treatment regimen for somebody who
Well,
has a
it
serious problem?
it all depends on the type of snoring. The first thing that we need to do, if someone snores aggressively, or if it disturbs your bed partner, or if you are tired, especially if you are tired during the day, and you slept enough hours, then the first thing that we need to do, it needs to be diagnosed to see what type of sleep breathing disorder we are dealing with. If it's only snoring, or if it's a more serious problem like obstructive sleep apnea syndrome. And depending on the specific clinical diagnosis, we can then um, prescribe or recommend the correct treatment. Treatment obviously includes um, behavioral treatment like quit smoking. That may help a bit for people who doesn't snore that much, or also what we call mandibular advancement devices, or mandibular plates that the dentist fits underneath your jaw to pull the lower jaw forward. Surgery may be indicated, but very, very little in adults. And then a procedure that we call positive airway pressure, which is a CPAP, or continuous positive airway pressure, that is very successful for treating any type of severe snoring or sleep breathing disorder.
Okay. So
Those
I
are
want
the
to.
four types of,
Mhm.
of, of, of treatments.
So now, as probably a spouse or partner or even a sibling sharing
Mm,
a room
mm,
with somebody
mm,
that
mm,
snores, how do we
mm,
handle this without even causing a shock? Because somebody is snoring and is not aware of it, and they are in deep slumber, but it's really
mm,
becomes it moves. So
mm,
it maybe starts as
mm,
irritation to
mm,
neutral to complete
mm,
frustration. And that's
mm.
how do you wake somebody up that is snoring and just allow them to maybe turn on the side or change their sleeping position, so to speak, without them having a
Mm.
shock, which is the best approach? Because you feel like you want to kick somebody or
I
punch them
know.
because you're
I
so
get that.
frustrated.
Yes.
Yes,
Yes.
but
Yes.
what do we do so that you don't shock somebody, because really, they're not aware of it. So, what is the
Mm.
best approach when it's in the wee hours of the night? Sure, short of calling you and saying, please help.
So the best way, obviously, because it doesn't only affect the patient himself or the snorer himself. It obviously affects the bed partner as well. So the first thing that we can do, and obviously it depends on the type of behavior that the person, his type of behavior. There's nothing wrong with waking him up, okay? But the best way is to record the snoring and to play it back to him the next day. And
Okay.
then, so that is the best way. If the person does not realize that he has a serious, or he doesn't want to take the responsibility that he has a problem, then the bed partner needs to look after himself or herself. And with that, I mean, we can use earplugs, or what we call white noise earplugs, or anything like that, just to block out the snoring. It's better said than done. It's not very successful most of the time. The second thing that we can do, step number two, is then get that person to consult with his doctor, and go to his doctor, or to any sleep clinic, and explain the snoring pattern. or explain the snoring, and that is treated very successfully. Snoring is not rocket science. Sleep breathing disorders are not rocket
Oh,
science. It's treated very, very successfully in South Africa, and even all over the world. It is not difficult to treat it, but it is important to get the correct diagnosis.
okay, so I want to focus on sleep apnea for a moment as well
Mm,
because
mm,
my spouse
mm,
suffers occasionally from sleep apnea. So it's not.
mm,
I've tried to make a list of when it was, but
mm,
I can't see any triggers. I mean,
mm,
it was. I mean, when we just got married early on, he told me as he sleeps, some days he'll be grasping for breath and he starts screaming. He
mm,
can't sleep in there,
mm,
and it
mm,
coincided
mm,
with me doing one of my psychology modules. And
mm,
I was so proud because it was then just a diagnosis that I could make on my own, because I told him, hey,
mm,
there's actually a label for what you experiencing. It's called
mm,
sleep apnea. And yes, sometimes
mm,
it becomes severe if I'm still awake and he's gone to bed early, and I hear the shouts and the scream and the afterwards the
mm,
heavily breathing. But at the
mm,
same time, to
mm,
get him up, I don't want him to get into shock. So
mm.
when somebody is experiencing a sleep apnea attack, what is the best form of support you can provide to your bed partner?
Let me just start off by saying sleep apnea is also the second largest sleep illness in the world. It is extremely common. It's very serious. It is not to be taken up lightly. Um, and and the more serious the condition is, the more comorbidities a patient has. So, for instance, let me just also tell you, because this is important to understand, that it's not only a cessation of breathing, or everybody laughs at you and it's a big snorer and it bothers the bed partner or anything like that. It has serious health consequences. Sleep apnea is a killer. It is not to be taken up lightly. It causes hypertension or high blood pressure. It causes heart disease. Our immune system is reduced. Patients normally feel that they are very tired during the day. They fall asleep very, very easily. So it's not to be taken up lightly. But the best way to handle it is, remember, sleep apnea will not go away on its own. It needs to be treated. Okay. And the best way to do it is not simply waking him up and tell him he's snoring. We need a more consistent medical treatment for that. And again, the best way to do that is to get that person go consult with his doctor, and the doctor then may prescribe or not prescribe, but refer him for a sleep study, a nocturnal sleep study, which is a diagnostic study which medical aids cover. It is like drawing blood. It's a very common diagnostic procedure in South Africa and all over the world. But that person needs a polysomnogram or a sleep study to determine the type of breathing disorder, how serious it is, and then the correct treatment can be prescribed.
So
Did I answer your question?
yes, I'm very encouraged in what you said in terms of treatment, because all the while throughout the conversation you're saying the different types of snoring and a severity, but with a correct diagnostic, there is treatment. So it can be treated.
Mm.
It's not like
Very
some untreated.
successfully.
Oh, and I love what you said,
Mm,
because you're
mm,
confident that it can be successfully treated. I guess you know what, we brush it off as not being so severe as an
no.
allergy, like allergic rhinitis
Mm-mm,
and something, but it does
mm-mm.
affect your health. And the fact that you
Yes.
said it's successfully treated is encouraging. And I think we should not wash it away or brush it away. I know it's potentially
Mm,
embarrassing to raise your hand and say,
mm.
I'm a snorer or I suffer
It's
from
very
sleep
common.
apnea.
It's
Yes,
very it's a very common. It's like someone who can't see properly. It's exactly the same thing,
yes. So
or
we need to remove the
yeah.
stigma. I think the stigma
Yes.
is what we need
Yes.
to remove from this disorder. In tell me, people like yourself, a sleep and health consultant, are they
Mm.
common or quite rare in a locality? If you Google, you'd probably find sleep and health consultants.
Yes, if you can just jump on Google. Sleep medicine is not a specialist, um, medical career in South Africa. So what we find is we find a lot of medical specialists, for instance, neurologists or pulmonologists or ENT specialists or GPs, who then focus on sleep medicine. You also get psychologists who focuses on their specific sleep medicine part. So, so, um, so that maybe there's also a lot of neurophysiologists, for instance, in South Africa. In South Africa, does our diagnostic studies for us, and they will, for instance, do a sleep study to determine the severity of snoring. And I'm, the neurophysiologists. So there's a lot of specialists in South Africa who focuses on sleep. There are very little people in South Africa who only does sleep in their practice. I am one, but there are very little of us. So unfortunately, we need to get our training from overseas. You can't get it in South Africa yet. I hope it will be rectified soon. Dr. Alison Bentley is one of she is the mother of sleep medicine in South Africa, and
Oh,
she has quite a good course. So you can, but there's if you can just jump on Google and find out sleeping problems or snoring problems, and you will find us. My website will pop up, and you can contact me. I've got a few blogs on my website that's interesting reading material with sleep illnesses and so on. Yes.
I'm definitely going to check that out as well. And it was so refreshing to speak to a specialist as yourself on sleeping. And like you say, it's a very, very common disorder. And probably, as you say, we all are snorers. So, hashtag we all are snorers at some time or some point in our life. So, we need to be careful when we make that bold statement is, no, I'm not a snorer. Maybe I think when you're doing a marriage checklist, sometimes that question does crop up. Do you snore? And then you, before you put the emphatic no, I think just go back to what you said, Mr. Ace, because at some point we can. But I think it's the severity of the sound and the labored breathing will determine whether treatment is required and the type of, as you said,
Yes.
labored breathing. I so enjoyed this conversation because I think we should be bringing such conversations to the fore. And I feel proud that we have specialists as yourself here in South Africa that we could contact. And thank you for your time and joining us here
Thank you,
on
Miriam.
Salam Media. Much appreciated.
Thank you, Miriam. Good luck to your listeners. Bye bye.
Thank you. And yes, that's a wrap of today's program, Mid Morning. Talk with me, your host, Maria Mia. And yes, I like to thank my engineers, our producers for very informative and varied program. Everything from paying tribute to our legendary freedom fighter, Ali Jilani, Sayyid Ali Jilani, as well as our very robust robust discussion panel discussion regarding catching up of lost time and whether LO should be removed from the curriculum for grade 10 to 12. We must that all our great interviews are available on Salam Media, YouTube, Facebook, and Mohammed. He's busy, and the podcasts are now done very timelessly. So you can go on SoundCloud and you can catch up because we all understand we have things to do and you might not have time to listen around uh, the clock or during your day. But yes, when it's time at the end of the day, when you've beat the clock and earn some rest and leisure time, please do go back and check out the very, very informative, inspirational, and educational offerings always here on Salam Media. Until next week, may you be under the mercy and protection of the Almighty. Assalamu alaikum wa rahmatullahi wa barakatuh. Peace and blessings to all of you.
Listen to something fresh.